I'm going to show you how to communicate with your accountant. AccuDent is gathering some information which are very useful for the accountant, such as the VAT, the incomes, the invoice, the claim form, the reimbursement, the pending payment, the executed procedures, the payment, the installment, the reimbursement. Everything is needed to get access to the accountant. So the first thing to do is to go to settings, you go to personal, and you are going to give an access to the accountant to the software. So request for that, and you are going to fill where the accountant is going to be able to get access and to which practitioner he will get access. This will help knowing what the accountant is doing when he is working with you on AccuDent. So that's point number one. So now let's see about the settings. On the settings, you have the personal, and in utilities, you go down and you have the VAT. That's the first thing to do. You need to set up the VAT. Here, today, the VAT is equal to 0% or 5%. In the future, maybe you will be able to add 10% or something else. Right now, we have 2 VAT to apply. So now, we need to give access to the practitioner, to the accountant, to a series of things. We call that the reports. So for Basilis, you have 2 levels of the reports. You have the report of Basilis, and as long as Basilis is the owner, you have the clinic report, which is only accessible to her. Okay, so let's go to report, and in report, you have the incomes. So the incomes, you need a password, and you have an incomes by months or from date to date. In the income, you will get the date of payment, you will get the name and the link to the practitioner. This is very interesting for the accountant because you will get access directly to the file of the patient. These are the amount. These are the invoice number, because every invoice number is linked to a patient, and that's very important for NABID and for DHA. And the insurance number and the payment, which is gone directly from the insurance. This is if you are in a network. So at this level, you will have the details of the payment, paid by cash, by charge, money transfer, or whatever. You will have also the total reimbursement. In case very exceptional that you will reimburse money to the patient, it will come here. What will not come here is the credit notes. So the credit notes will be visible in another place, and we go there in a patient's financial report. The patient financial report is very interesting for the accountant, and you can select today, you can select per month, per year, current year. In current year, you can tick on that, okay? And when you tick on that, you can send email directly to the patient. What you can do also, you can export to Excel file. And this is what you can export. You have executed or invoiced amount. So this is different. What is executed in some cases is due, but it's not invoiced. Insurance name in case. Executed copay amount. This is sent by the copay. Invoice copay amount. VAT. Reimbursement in case of reimbursement, credit note in case of credit note, the patient paid to the amount paid by the patient, the copay the insurance has been paying directly. This is the balance for patient, and this is the balance for copay, and this is the total balance. You have a clear idea of all what needs to be done, and this can be printed or this can be exported to the accountant, given access to this page, and the accountant will have all the information to do that. What's interesting also is to go to pending payments. Pending payments is when you have a payment which is not done on something. So you have the list of that, And what you can do, you can select tick, and you can send an email. For example, we want to remind you that you have to pay this and this, and send that, and you will manage your templates in the invoice. And you can work here, and you can put a comment, and this comment will follow up what you are doing with that. So you go to comment, and you can add forget the payment, and this will be attached to the patient's file. So like this, the accountant will know how this is working for this patient, and you will go back to get the money, or you will stop getting the money for that. So let's go again to that. And this is something also very important for the accountant, is the clinic VAT. The VAT is paid by the clinic. It's not paid independently by the practitioner. This is why you will find that in clinic reports. So you have the VAT, which is linked to a credit note. You have the VAT, which is linked to an invoice, and you have the date of all these things. And you have no invoice in some cases, but you have VAT already. So you have the amount, VAT 0, VAT 5%, total VAT, total full amount, and status. Status can be posted, and status can be void, okay? So you have different kind of status. And you can look by practitioner, you can select what you want, and you can select the search. So if you go to a practitioner, you have also the pending payments, but these are only the pending payments of Basilis, okay? It's not the pending payment for all the clinic, and then you can work independently for each practitioner or for the whole clinic. So these are all the things which are very important to transfer to the accountant. What you can do also, you go to a patient's file, you will leave the accountant to do that, and when you go to payment, you will have the list of executed payment, not only the list of executed payment, but the invoice number linked to each payment, okay? So what you have also, you have the credit notes. The credit notes are done here, and there is a credit note number that you can find here. You can delete, you mean void. We never delete what's linked to payment and invoice and payments. So, and you can print a receipt for that. So all that is linked to a patient, practitioner, and in payment you have also the reimbursement. In case you make a reimbursement, it will be linked as a reimbursement, and the number of the reimbursement will start with RE, means that it's a reimbursement. Same as credit note is starting with CN for credit note, and payment are just starting with the number of the payment. Voilà, you have a good idea now of what you can link to the accountant, and please give an access to the accountant as a responsible person. This is the way to allow him to go where he wants and get the information without bothering the people working at the clinic to get the right information. I thank you for your attention.